Hi, I'm Dr. Tubbs. I'm going to talk to you about nutrition. Did you know, of all the industrialized countries in the world, the United States is one of the worst regarding obesity, diabetes, autoimmune disease, heart disease, dementia, infertility, and cancer. These serious health epidemics are destroying our health and our healthcare system. Because of these epidemics, especially obesity and diabetes, there is a strong potential for healthcare bankruptcy by the year of 2050. According to a recent study by Johns Hopkins University School of Medicine, they concluded that by the year 2048, all American adults will be overweight or obese, and 50% of all Americans will be diabetic. And by the year 2030, almost 50% of the population will have some form of cardiovascular disease. There will be a direct medical cost that will triple to over $818 billion. From a wellness and healthcare perspective, we are failing. Makes me think of Einstein's definition of insanity. Doing the same thing over and over again and expecting different results. This is why I think medical schools should place a greater emphasis on teaching wellness and functional medicine and nutritional biochemistry, and less on pharmacology. Pharmacology absolutely dominates medical school lectures and dominates mainstream medicine. On average, student physicians receive 23.9 contact hours of nutrition instruction during medical school. Most doctors would agree they don't know much about nutrition, and the 24 hours they did receive was based on the failed USDA recommendations. More on the USDA failure later. What is the typical advice given from your average mainstream physician when a patient asks, "Hey doc, I need to lose some weight. Can you help me? What do I need to do?" The typical doctor's advice? Oh, just eat healthy, eat less, and exercise more. Now that's informative, but true. We need more true wellness and functional medicine practitioners because guess what? This country is #1 in the world in obesity. Here are the top 10 most obese countries in the world. And #1 is USA. Yay! #2, China, followed by India, Russia, Brazil, Mexico, Egypt, Germany, Pakistan, and Indonesia. Now let's look at the percent of American men and women who are overweight or obese. Based on gender, 40% of American women are obese, 33% are overweight, 37% of American men are obese, 40% are overweight. Why did this happen? And when did these epidemics start? It all started in the 1950s. Fast food restaurants were on the rise between the 1950s and 60s, including McDonald's, Burger King, Wendy's, Jack in the Box, Carl's Jr., KFC, Taco Bell. Also, processed foods were being mass-produced and distributed thanks to the expanding highway system in this country. Also, processed foods became a household staple. This for convenience purposes. During this time, we had the birth of the microwave oven. Around 1977, the government realized that Americans were becoming more obese, diabetic, and suffering more and more with heart disease and autoimmune disease. To address these issues, a noble cause, they formed the USDA McGovern Committee headed by Chief Scientist Ansel Keys. They created the USDA Food Pyramid, which was based on very few and limited animal studies and not one well-designed human study. Their recommendations were based on opinions, hypotheses, absent of strong scientific data. Since the government was involved, decisions were also strongly influenced by the food lobbyists. The food lobbyists had political leverage. After all, they contributed millions to these elected officials' campaigns. Let's see how these USDA recommendations contributed to the health of Americans over the past 40 years. The past and current USDA recommendations prescribed to Americans has proven to result in serious obesity, diabetes, heart disease, and autoimmune disease epidemics. We can fix these epidemics. Pharmaceuticals and surgery are not going to correct these problems. Drugs and surgery may temporarily help, but will never fix and usually creates a new problem. For example, gastric bypass surgery has helped people lose weight and reverse diabetes. But when you redesign the GI tract, you're inviting both macro and micronutrient deficiencies and their accompanying new health problems. A well-formulated nutrition plan can fix these epidemics. The most powerful prescription is nutrition. Hippocrates said, "Let your medicine be your food and your food be your medicine." The nutrition biochemistry to support this has been known and politically suppressed since the 1880s. Think about this. Every single biochemical in your body comes from your food. So, if you are not providing your body with the right nutrients and or the right balance of nutrients, and worse yet, consuming anti-nutrients from processed foods or from foods you weren't genetically designed to eat, you're setting yourself up for imbalances, deficiencies, and disease. This is not my opinion. This is scientific fact. Let me give you one of the many real-life examples on how powerful nutrition as medicine can cure so-called incurable diseases. For 4 years, secondary progressive multiple sclerosis confined Dr. Terry Walls to a wheelchair. She received the so-called world's best chemotherapy and medical care at the famous Cleveland Clinic, but ended up in this wheelchair. Frustrated with the typical mainstream medicine, she researched and discovered how powerful nutrition can heal multiple sclerosis. She is now helping thousands around the world heal from autoimmune disease using nutrition and functional medicine. This may be the first time you're hearing a physician talk like this, and you ask why. Why? Because the pharmaceutical companies, the food lobbyists, the government, and unfortunately, and to some extent, mainstream medicine do not want you to know this. This creates an economic threat to these special interest groups. Remember that $818 billion medical cost projection? Entities are going to make a lot of money at the expense of Americans' health. I have helped many patients fight disease and win by curing themselves of diabetes, fibromyalgia, autoimmune disease, chronic arthritis, and obesity. Meet Caleb. He developed obesity and diabetes and fought to eliminate his obesity and diabetes, all in less than a year. He is feeling great and loves his new body. And he tells me, "I'm not done." With my nutrition prescription, I can guarantee you will experience energy through the roof, substantial body fat loss, elimination of brain fog, unbelievable mental sharpness and memory improvement, elimination of cravings, decreased appetite, better sleeps, healthier looking skin. And the athletes and fitness enthusiasts will experience increased strength, increased cardio, and better recovery. My nutrition prescription is not as hard as you think. Let me show you how. Give me 30 days to teach you how my nutrition prescription can be life-changing. I need to earn your trust, but you can always trust yourselves. If I am wrong in my recommendations, your cells will tell you. If I am right, and I am confident I am right, your cells will reward you. I am confident in my nutrition prescription. I have seen it improve my patients' quality of life remarkably. Every recommendation I make to you, I do. I talk the talk, and I walk the walk. Walk.